Hi, this is Teddy. Teddy is 67 years old. He initially presented to the hospital with complaint of shortness of breath and chest pain. He was diagnosed with severe coronary artery disease, underwent a bypass, and had some complications during recovery. Went into respiratory failure and came here to CareOne on the vent to be weaned. So we started using the Passy-Muir when he was still on the vent. Now he's on trach collar. He has a number 8 trach. The cup has been deflated here. And we are going to put the PMV on so we can hear Teddy's voice. Okay, ready? He has been suctioned and oral care was provided prior to the session. One moment, okay? So I want you to repeat what I say, okay? You say good morning.
Good morning.
One more time. Take Teddy, yes. Could you take it?
I was practicing
Okay, you had an accident in March? And now you're here, Teddy. This time you're getting much better. Much better, yeah. I'm going to give you something to eat today, okay? We're gonna have some pudding, and then Lillian's going to suction you to make sure there's no blue in your trach. And we'll see if hopefully soon you can start eating, okay? First, I want you to take a deep breath and say, ah. Good. Can you clear your throat? Go, and swallow. So we've talked about the valve, and we know that when we use the valve, we can hear your voice, but when I give you something to eat, we'll also be able to hear if you're coughing, clearing your throat, or if your voice changes in quality. So.
Yeah.
You're here, yeah.
And right now,
Right now we have some work to do to get better.
I was speaking.
It was a long time you couldn't talk, right?
And I can talk about my life.
Yeah.
And to my past.
Are you happy to be able to speak now?
Very happy because
Yeah, it's difficult when you can't tell people what you need.
everything that changed for you.
Oh, you're very welcome. Our pleasure. So I'm going to give you some pudding now, okay? Before we start, I want you to swallow. I'm going to feel your throat. Swallow your saliva. Very good. We're going to take a few spoons of pudding, and then Lillian will suction you to make sure that nothing is in your trach. It's blue so that we can see when we suction if anything is in your airway, okay? Very good. Can you say ah? One more time. Take a deep breath and say ah. Good.
Maybe my hand.
Your what?
My hand.
Your hand?
Hat.
Your hat. You'd like your hat? Okay. One moment. We'll take 2 more bites and then I'll look for your hat, okay? Good. Good. Is the pudding good? Very good. Can you say ah? Go. One more, okay? After this one, Lillian is going to suction you. All right? Okay. Ah. Very good. Okay. So Lillian's going to suction. We're going to check for any blue. Okay?
Okay, Teddy. I'll hold this. Just gonna use it to suction. Okay?
can see his oxygen is still great. He's 99.
Right.
Your hat?
Yeah.
Yes, I will get your hat.
Put this to the side.
We're
Yeah,
just
take it
going to
off or
check
just
for
leave
any
it?
blue, and then I will get your hat, okay? I'm just going to put a white sheet here so that we can see clearly.
Okay, then. Gonna be your trach,
Now
okay?
keep your mouth closed. Good, that looks clear. Yeah, very good. Okay,